Most dehydration is annoying, not dangerous. But some symptoms are your body's way of saying, this is more than just being thirsty. If you miss those signals, dehydration can affect your brain, your heart rhythm, and your kidneys faster than people expect. The goal here is simple. You'll learn which signs are normal, which ones are red flags, and when it's time to get medical help instead of trying to push more water at home. We'll also talk about who is at higher risk, like infants, older adults, and anyone with vomiting or diarrhea. And we'll cover a key idea many people miss. Sometimes plain water isn't enough, because you're losing salts along with fluid. By the end, you'll have a practical checklist you can use in real life, for yourself or someone you care about, without panic and without guessing. Moving to slide 2. Dehydration means your body doesn't have enough fluid to do basic jobs, like keeping blood pressure stable and regulating temperature. It's not only about water. You also lose electrolytes, mainly sodium and potassium, which help nerves and muscles work. Common causes are heat, exercise, fever, vomiting, diarrhea, and not drinking enough. Some medications can contribute too, like diuretics that increase urination. A helpful way to think about it is supply and demand. If you're losing fluid faster than you replace it, your body starts conserving. You pee less, your mouth gets dry, and your heart rate may rise to keep blood moving. Mild dehydration is often manageable with rest and fluids. The red flag zone starts when dehydration begins to change mental status, breathing, circulation, or urine output in a significant way. Moving to slide 3. Let's separate typical symptoms from warning signs. Mild to moderate dehydration often feels like thirst, dry lips, darker urine, a mild headache, or feeling tired. You might notice you're peeing less, but you're still alert and able to drink. Red flags are different. They show that the body is struggling to maintain normal function. Think confusion, fainting, severe weakness, chest pain, trouble breathing, or not being able to keep fluids down. Another red flag is very little or no urine for many hours, especially if you're also dizzy or your heart is racing. The key is trend and intensity. If symptoms are getting worse despite drinking, or they're severe from the start, that's not normal dehydration. It's a signal to stop troubleshooting at home and consider urgent care. Moving to slide 4. Mental status changes are one of the most important red flags. If you feel confused, unusually irritable, very drowsy, or you can't focus, dehydration may be affecting blood flow and electrolyte balance in the brain. In kids, this can look like extreme sleepiness, not responding normally, or being hard to wake. In adults, watch for disorientation, slurred speech, or acting not like themselves. Fainting or near fainting is also a big deal. It can happen when blood volume drops and blood pressure can't keep up, especially when you stand. If someone passes out, has a seizure, or cannot stay awake, treat that as urgent. Don't assume it's just heat or not eating. These symptoms can overlap with other emergencies, and dehydration can make them worse. When the brain is involved, it's time to seek care. Moving to slide 5. Your heart and circulation give other clear warning signs. When you're dehydrated, your heart may beat faster to compensate. A mildly higher pulse can be normal after exercise, but a fast heart rate at rest, pounding heartbeats, or feeling lightheaded can mean your circulation is under strain. Pay attention to chest pain, pressure, or shortness of breath. Those are not symptoms to hydrate through. Another clue is cold, clammy skin or a gray, pale look, which can suggest poor perfusion, meaning blood flow to the skin is reduced. If you stand up and your vision goes dark, or you feel like you'll pass out, that's orthostatic dizziness and can be significant. If these signs are strong, persistent, or paired with confusion or low urine output, it's appropriate to seek urgent evaluation. Moving to slide 6. Urine is one of the simplest ways to gauge dehydration, and it can also signal danger. Darker urine can happen with mild dehydration, but the red flag is very low output. If you're barely urinating or not at all for many hours, your kidneys may be conserving aggressively. That can become a problem, especially if you're also vomiting, having diarrhea, or sweating heavily. Another warning sign is pain in the side or lower back with dehydration, or swelling in the legs, which can point to more complex kidney or circulation issues. Also pay attention if urine is tea-colored or you see blood. That needs medical evaluation, dehydration or not. The practical takeaway is this. If fluid intake is reasonable, but urine stays minimal, or symptoms are escalating, don't keep waiting for it to turn around. Moving to slide 7. Vomiting and diarrhea are dehydration accelerators, and they change the decision-making. If you can't keep fluids down, you can't rehydrate effectively at home. Repeated vomiting, frequent watery stools, or symptoms lasting more than a day can quickly drain both water and electrolytes. Watch for dry mouth, sunken eyes, dizziness, and weakness that makes it hard to stand or walk. Another key point is fever. Fever increases fluid loss, and it can also signal infection. If dehydration is paired with high fever, severe abdominal pain, or black or bloody stools, that's a reason to seek care. The risk is higher for older adults and for anyone with chronic conditions. The goal isn't to diagnose the cause at home. It's to recognize when losses are outpacing what you can safely replace on your own. Moving to slide 8. Heat illness is a common setting where dehydration becomes dangerous. If you've been in high heat, especially with physical activity, dehydration can overlap with heat exhaustion or heat stroke. Warning signs include headache, nausea, heavy sweating at first, and then sometimes hot, dry skin if heat stroke is developing. Confusion, stumbling, or collapsing in the heat should be treated as urgent. Another red flag is a very high body temperature, or chills and goosebumps in the heat, which can mean your temperature regulation is failing. Cramps can happen with salt loss, and they're a hint that electrolytes are involved. The safest approach is to stop activity, move to a cooler place, and seek medical help if symptoms are severe, mental status changes appear, or recovery is not quick. Heat-related dehydration can escalate rapidly. Moving to slide 9. Here's a subtle but important red flag. When drinking water doesn't help, or it makes you feel worse. If you've lost a lot of sodium through sweat, vomiting, or diarrhea, replacing only water can dilute sodium further. That imbalance can contribute to headache, nausea, confusion, and in severe cases, serious neurologic symptoms. This doesn't mean sports drinks are always the answer, and it doesn't mean you should overdo electrolytes. It means you should consider balanced oral rehydration solutions, especially during significant GI illness. Another clue is persistent muscle cramps, tingling, or unusual weakness, which can reflect electrolyte shifts. If someone is confused, vomiting repeatedly, or has severe symptoms, don't try to fine-tune electrolytes at home. Get medical care. The main idea is to respect the difference between thirst and fluid plus salt loss. Moving to slide 10. Some people should treat dehydration symptoms as urgent sooner because their safety margin is smaller. Infants and young children can dehydrate quickly, and they can't always communicate thirst or dizziness. Older adults may not feel thirst strongly, and dehydration can show up as confusion or falls. Pregnancy adds extra fluid needs, and vomiting can become risky faster. People with diabetes can have dehydration from high blood sugar, and that can become an emergency if accompanied by rapid breathing, confusion, or severe fatigue. Kidney disease and heart failure also complicate hydration because fluid balance is delicate, and if you're taking diuretics or certain blood pressure medications, dehydration can hit harder. The practical takeaway is simple. If you're in a higher risk group, don't wait for extreme symptoms. Seek advice early when warning signs appear. Moving to slide 11. Let's make this actionable with a Seek Care Now checklist. Get urgent medical help if there's confusion, fainting, seizure, or inability to stay awake. Seek care if there's chest pain, significant shortness of breath, or a fast heart rate that doesn't settle with rest. Go in if you can't keep fluids down for hours, or if vomiting and diarrhea are severe or persistent. Another strong trigger is minimal or no urine for many hours, especially with dizziness or weakness. In children, red flags include no tears when crying, very dry mouth, fewer wet diapers, or a sunken soft spot in infants. If you're unsure, it's reasonable to call a nurse line or clinician for guidance, because dehydration can look like other serious problems. When multiple red flags stack up, don't wait. Moving to slide 12. If symptoms are mild and there are no red flags, home rehydration is often reasonable. Start with small, frequent sips rather than chugging a large amount, especially if nausea is present. For significant sweating or GI losses, consider an oral rehydration solution that includes both glucose and electrolytes, because that combination improves absorption in the gut. Keep the environment cool, rest, and avoid alcohol. Be careful with very sugary drinks, because they can worsen diarrhea for some people. Also be cautious with excessive plain water in a short time if you've been losing a lot of salt. The goal is steady improvement, clearer urine, less dizziness, better energy, and a more stable pulse. If you're not trending better within a reasonable window, where symptoms rebound quickly, that's a sign you may need medical evaluation. Moving to slide 13, a final point. Dehydration symptoms can mimic other emergencies. Dizziness and weakness can come from low blood sugar, anemia, infection, heart rhythm problems, or medication side effects. Confusion can be dehydration, but it can also be stroke or severe infection. That's why the red flag approach matters. You're not trying to self-diagnose. You're deciding when the risk is high enough to get help. Here's a simple way to remember it. If the brain is affected, if breathing or chest symptoms appear, if urine output drops sharply, or if you can't replace losses because you're vomiting, treat it as a medical problem, not a hydration project. If this was helpful, subscribe for more clear health explanations without the hype. And comment with a forced choice. Which is harder for you, drinking enough in heat or staying hydrated during a stomach bug? This information is not a substitute for medical